Eric, you're next.
Hi, Mr. Chief Minister. Thank you so much for having me, Sumatra. It's a pleasure to be here. I'm from a company called Organovo, based in San Diego, California. We have a 3D bioprinting process, and we use a specially modified 3D printer that we actually produce ourselves to make functional human organ tissue. If I take a step back for a moment, I'm sure as all of you know, no nation in the world comes remotely close to meeting its solid organ transplant needs. There's obviously just a tremendous mismatch between people who need organs and the available supply of organs. And so that is how our company was born, was thinking, gosh, how can we alleviate this need? Our scientific founder was a Hungarian biophysicist who was studying how tissues develop in our bodies. And he developed the bioprinter as a way of trying to force cells to self-assemble into tissues in an in vitro setting, in other words, outside of the body. And it turns out that when you have cells and you put them in a three-dimensional matrix and give them approximately the right architectural relationships to one another, they will do a lot of the work for you and form these tissues. So right now we use the tissues that we make for two lines of business. One is that we, since creating actual organs and implanting them into people is a few years away, we create smaller pieces of tissue that pharmaceutical companies and biotech companies, cosmetic companies can use to do research on. First of all, this dramatically reduces the need for animals for use in these kinds of preclinical tests. It also, being fully human and being architecturally correct tissue, is much more clinically relevant and more predictive. So we work with many of the top 20 pharmacos, a lot of cosmetic companies like L'Oreal and others, at these sorts of things. And then we are currently working on implanting tissues into the body and hope to be in clinical trials within the next 3 to 4 years. Liver will be our first indication. We're developing a patch of tissue that is about the size of a dollar bill, a US dollar bill. It's about 1 millimeter or so in thickness. That piece of tissue has several different cell types in it. It can be bioprinted in a matter of about 15 minutes. And we hope that for certain diseases, for certain childhood liver diseases, this may actually be curative and prevent a transplant for kids who will die without a transplant. And for other diseases, like certain types of acute or chronic liver disease, we can't yet make enough tissue to fully replace a transplant, but we hope to bridge patients a few more years before they may need a transplant, which in and of itself would help alleviate that supply-demand mismatch for organs. So in addition to liver, we work on kidney, we work on lung, we work on a number of other tissues, and that is basically what we do. So thank you very much.
So much. Thank you.